This presentation is over the usefulness of eccentric hamstring strength as a hamstring injury predictor, and it's a critically appraised topic by myself, Kira Wicker, and it was reviewed and edited by Jared Spencer and Dr. Jennifer L. Volberding. Hamstring injuries represent a big part of sports injuries, and those who have a hamstring injury are at risk for re-injury. And studies have found that a lack of eccentric hamstring strength is a factor that can lead to hamstring injuries. And clinicians have been using preseason physical examinations to try and identify any areas that could lead to injury or illness within sport. And so I wanted to look and see if eccentric hamstring strength could be used as one of those factors to predict hamstring injuries. So the focus clinical question is eccentric hamstring strength an effective predictor for hamstring injuries in athletes? And I specifically excluded any studies that had eccentric hamstring strength programs or protocols within them. So the studies range from 140-ish to 400 males, and two of the studies included soccer athletes. One of the studies was done on Australian football players. All three studies used a different way to test the eccentric hamstring strength, and the Shalaj et al. Study used a Nordic hamstring strength test, where if the athlete could not perform the Nordic hamstring exercise beyond 30 degrees from the starting point, it was pass or fail. So they passed if they could get below that 30 degrees, and they failed if they couldn't. So all the studies were evaluated, and we wanted all level 3 on the OCEBM scale, and all three studies were also prospective cohort studies. They all measured hamstring strength a little bit differently, and the first two studies, Van Dyke and O'Barr et al., were both not found to have eccentric hamstring strength as an injury predictor, but the third study, the Shalaj et al., did find that eccentric hamstring strength could be used as an injury predictor. So overall, eccentric hamstring strength can be looked at as part of the physical examination, and it could be used as part of a comprehensive way of identifying those at risk, but it shouldn't be used by itself.